Roxanna. So,
Hi Hazel.
this is our principal dentist at Bradford Dental Clinic, and she's also a ClearCorrect ambassador. And I'm going to ask her some questions that we've got from patients, from consultations that we've done, just asking the most frequent questions that we've got recently.
Sounds good.
Yeah.
Excited?
So the first one is, how often will they need to come to see the dentist once they start treatment?
So this is a really good question, Hazel. It's actually, I think, the first question we get asked by all of our patients. And the answer is, it really does depend on your treatment plan and the number of aligners that we have planned. However, when the aligners arrive, we need to see everybody for that very first appointment. We call that the day that we start your treatment. You would come in and have your engagers done and have any space creation done. And then we would load you onto our monitoring system and do your first scan in surgery. So we do that together, don't we, Hazel?
Mm-hmm.
So your first appointment, you have to come so you can start treatment, but thereafter your appointments will be dependent on what's needed. I have to say, with the dental monitoring that we do here at Bradford Dental Clinic, it really reduces the number of appointments you need, because we appreciate that all our patients are quite busy. Everybody's got busy lives nowadays, and with sort of the time of year, Christmas, etc., people are busy. So what we've done is introduce this monitoring system to the patients at Bradford Dental Clinic, which means that you send us a weekly scan, which is on your smartphone. It's easy to do. Would you agree, Hazel?
Yeah.
I think it's quite easy to do. And you send us a scan on your smartphone, and we have a look at it here in the practice, and then we send you a message through the app which tells you whether you should stay on that same aligner or whether you might need a few more days with that aligner in. So you would stay in that for another 3 days, scan again, and then the app will tell you whether you can move forward or not. So it does make it very easy, and we do reduce the number of visits to try and make it easier for our patients.
So the next question that we've dealt with recently is, can patients still wear sporting mouth guards for if they do lots of rugby or martial arts?
Yeah, and again, Hazel's absolutely right. That's something we've been asked a lot. And the answer is, of course you can wear your sports mouth guard. You should probably take your aligners out before you try and put the sports mouth guard in, because you can't put both in together. What I have said to a lot of my patients who have maybe had customised mouth guards made is that as you progress and your teeth start to move, which is inevitable, the mouth guard that you had made at the beginning probably won't fit anymore. So you may need to do a few changes along the way. And then when your treatment is fully complete, we can make you a new customisable mouth guard, which again is a digital workflow. That's something that we can provide for you here at Bradford Dental Clinic. So having clear aligners shouldn't stop you from doing any sports or any activities that you're passionate about.
Cool. So the next question is probably the most common question. How do patients look after their teeth while they're wearing clear aligners?
And again, that is a great question, and I agree with you. I think we get asked that a lot. So the advice that we give to our patients is that we need you to wear the aligners for 22 hours a day. So patients sometimes start doing the maths and they look at me like, 22 hours? And the 2 hours that we're telling you that you don't have to wear your aligners are your meal times in essence. So when you eat something, you have to remove your aligners, eat your meal, you can eat whatever you like, and then brush your teeth and floss, so use your little interdental brushes to clean in between, and then your aligners go back in. We provide you with a case when you start your aligner treatment, so when your aligners are not being worn in your mouth, they should be in the case for safekeeping. And you can clean them once a week using lots of various products that are available over the counter. But roughly, your aligners are going to be worn for 7 to 14 days, depending on your wear schedule. So you'll be changing aligners quite frequently anyway. I hope that's helpful.
Yeah. So the next question is, can patients see what their teeth are going to look like before they go ahead with the treatment?
Yeah. I think this is the most lovely part of our consultation process, actually, Hazel, because you're absolutely right. I think we need to see the outcome before we start treatment. So we normally, during our consultation, we would take a digital scan, we would take photos and any relevant x-rays that are needed. And we usually like to book patients back into the diary because we want to go through the simulation. So while you go home, go about doing your business, I'm working on your treatment plan in the background, and I sit down and go through the treatment and look at the prescribed movements for the case and decide how we're moving the teeth and what movements are required to make it predictable. And then when you come back, you get to see the finished product, and I will go through with you your before, after, and all the steps along the way. And we tend to look at that 3D simulation in multiple views. We tend to go through with you exactly what engages are needed, how much space creation is needed. For example, in some cases we're using buttons and elastics to improve the smile. So we go through all of that in a high level of detail, and then we provide you everything to look at home, because I appreciate it's a lot to take in when you come to these appointments. So we do like to provide our patients with the link and the password so they can go home and look at it in their own time. And people like to show their family and their partners and their friends, and I think it's quite a nice way to sort of decide on the next steps and how you want to proceed.
So if a patient sees a simulation and they go, actually, I like it, but there's a couple of things that I want to change, does that simulation, is that the final one, or can you discuss it with the patient and then make changes?
Absolutely, Hazel. So we would have our patient with us in the surgery so we can discuss the simulation, and patient feedback is key. We want to know what you want out of the treatment, and we want to take that into account as our number one part of treatment planning. And we can actually make changes together on the Clear portal, so you could tell me I'd like that to move forward a little bit more, and we can do it there and then on the portal and get another revised simulation. We don't order aligners until both myself as your treating dentist and you as the patient are 100% happy, because if we're not, we're having different expectations and outcomes. So yeah, absolutely, that simulation is not a final blueprint, not at all. That is basically the first draft, and comments and feedback are always welcome.
So next question is, does teeth straightening hurt?
Well, pain is subjective, I'll say that. It's not painful, it's more of a dull ache, and it's the same if you were having a fixed brace or clear aligners. Both are orthodontic movements. So an orthodontic movement is moving a tooth position through the bone. So it's only natural that you will get some discomfort. Now, most of our patients would have some pain for the first 1 or 2 days, and that pain can be quite easily managed with painkillers, like whatever you would take normally for pain that you can buy over the counter. We've never had anybody need it for longer than that, and generally the first couple of days you feel it, and thereafter you're absolutely fine. So we don't tend to find that to be as much of a problem as people sometimes think, because understandably you can be worried about pain. But 1 or 2 days of discomfort because you feel that something is happening, and then people are usually absolutely fine.
Yeah. So the next question is, how long will treatment last?
So the treatment length of time varies depending on the case. Sometimes people have quite mild situations, so they may only have a few movements needed. So in some cases we can finish treatment in 4 to 6 months. In some cases treatment can go on for 18 months or 2 years. And most of them sit somewhere in the middle, 6 to 9 months. And the reason for that is because it just depends on the severity of the position of the teeth in the first place. So it's not set in stone, but I can just sort of say that it will be on a case-by-case basis. You asked about treatment lasting. So what that means to me as well is not just the treatment duration, but also after treatment is complete and you've finished your teeth straightening, what happens next? And if you want to keep your teeth straight, you must comply with the retention program that we provide for you. And what that means is if we provide you with nighttime retainers and tell you you must wear them every night, we strongly recommend that you do that, because if you stop wearing your nighttime retainers, there is a high chance that your teeth are going to start moving back. And that's the worst thing. When you spend all that time and effort in straightening your teeth, the last thing that you want is for them to start to move back. In some cases, we also provide a bonded or a fixed retainer. So again, it depends on the case and it depends on the discussion that we've had together on the need for that. But whether it's a bonded retainer or a nighttime retainer, your treatment or your teeth will stay straight as long as you comply with the instructions that we advise.
So are there any things that would stop you from being able to do ClearCorrect treatment on a patient? For example, if they had a tooth missing, or is there anything where you would say to a patient, we can do it, but we can't do it right now?
Yeah, and I think we see a lot of that here, don't we, Hazel, where people come wanting to have their teeth straightened, but perhaps people haven't registered with a dentist, or they have active gum disease, or they have cavities that we need to treat before we can do clear aligners. So I would say if you're in doubt and you don't have a dentist and you haven't seen a dentist for a long time and you're not quite sure how to proceed, give us a call, speak to one of our friendly team about your concerns. They can advise you. It may be that you need to see the dentist for some baseline restorative work, or you may need to see a hygienist before you start treatment. So there are some conditions that will prevent us from being able to do the straightening immediately, but that doesn't mean that we couldn't do it at a later stage once we've stabilised. For example, gum disease is quite a common one. So once your gum disease is stable, then we can reassess your suitability for clear aligners and teeth straightening.
And how much roughly, so if a patient comes in and they want the treatment, are there different payment options, or does it have to be a straight upfront payment?
We actually pride ourselves on having multiple payment options here at Bradford Dental Clinic, and we have packages starting from 2750 for a very basic minimal package, all the way up to 4675 with lots of additional extras like whitening and different retainers. We offer interest-free finance here at the practice, and we also have longer finance as well. So we have quite a few different ways that patients can opt to pay for their treatment. So we hope by offering all those different options, people will be able to pick something that suits them and their budgets and make it more affordable and easier to spread out the cost of your treatment.
Well, you heard all the questions here. If you do want to book in for a consultation to see Sana and myself, contact us at Bradford Dental Clinic on 01274 00 3333, or you can go onto the website and contact us via WhatsApp if that's easier.
Thank you.
Thank you.